By way of introduction here, I created a little bit of notes for myself. So many of you are aware that this is now an unprecedented time for medical student research across the country. I mean, with the current board situation, people are reaching out and having a hard time finding jobs. The things that I would tell students that are looking for research is to ask themselves how important it is. I mean, I think that that is probably the most important question to ask. The skill positions are ones where research has historically always been important. Others perhaps not so much, but as everybody's looking for ways to distinguish themselves in a pass-fail environment, research can have a role. The things that have always mattered and will always matter, irrespective of what you're trying to get into, is a documented evidence of commitment and interest in the profession. You have to show that you really want it. And another thing that is very important is if you're applying for a residency position, it is really helpful if you have somebody in that position writing you a letter of recommendation who is known by the residency program director. Those are things that have shown up on lists as being very important for years. When it comes to research, so I think Katie Harden was also planning on joining us. I don't know if she's going to be here, but I assembled people here that will hopefully share some of their real world experiences. I didn't want stuff to be sugar-coated. There are a lot of students that get their names on abstracts in undergraduate school simply for showing up and watching the science being done, and that is not going to happen in medical school. So research is hard work. It can be frustratingly slow. As Dr. Arndt said yesterday during his presentation, time is your biggest enemy here. You need to be able to get into a project that has a fairly high likelihood of yielding some results, and then you have to get that published as quickly as possible. So the people that are assembled here are people that I hope can share their real world experiences with you. And so why don't I start off with those people on the Zoom call here first. So I got Molly from the KC campus and Jana. So Molly, you want to take off and just tell us briefly, start off by telling us what you did. We'll talk about the problems later, but you know, she did a project that piqued my curiosity. So please share a little bit.
Sure, thanks Dr. Wolff for having me. I apologize, my voice is not at its best. It's been given out on me lately, but to start, my name is Molly O'Brien. I'm a fourth year at the Kansas City campus. And a little bit of background, I am in the global health track, which requires a research project. So I got together with a group of girls and we were going to go to Kenya and do some research surrounding menstruation awareness. And then COVID-19 happened and the trip was canceled and you know, our theme didn't really apply anymore. And so we got back together and we're like, well, we're gonna have limited patient access because security has become more strict to restrict, you know, COVID-19 spreading further. We're also limited on who we can reach. I think a couple of us in our group were, one was in California, one was in Colorado, and two of us were here in Kansas City. So we thought we'd have a wide reach, but we actually didn't. And so we were like, how can we get enough people to respond to something during a pandemic? And furthermore, what topic are we gonna do? So we decided, I'm sure all of you can relate, that anxiety and depression skyrocketed at the beginning of the pandemic and throughout. We're isolated, we're stressed, we're worried, fearing for our loved ones, etc. So we decided to evaluate, sticking with the women's health theme, anxiety and depression trends with people who are currently pregnant during the pandemic. That includes people who could no longer bring their significant others to ultrasound appointments, maybe had restricted access for loved ones coming in during the birthing process. On top of that, just the stress of being pregnant. And then on top of that, worrying about the pandemic. We had some other aspects, but we were like, okay, well, if we just go to our OB-GYN rotation, we might get maybe 40 responses, you know, if we were even allowed to distribute in that scenario. So we kind of put our heads together and we were like, well, we could do an online survey, but how do we get it out to people? And we thought social media, which is kind of a strange way to get medical research these days. But what we did was through Facebook, they have basically a targeted system where using certain keywords and demographics, you can target certain audiences. It did cost a little bit of money, so we applied for a grant through KCU, and they gave us like, I think maybe $500 to pay Facebook to advertise our survey. And we had it open, we shared it on our public pages, but also through a, you know, likable page that was not linked to our personal accounts. And through this journey, I think it was live for about 2 months or so. We paid per click, so every time it was clicked on. We had an English version and a Spanish version to get as many people as we could. And I think we obtained over 1,000 responses, which was pretty great, from all over the United States. Once we filtered out kind of who met our criteria and the timeline, we ended up with 850 responses total, which is much better than probably we could have gotten in Kenya by ourselves. So it took a lot of time. Like Dr. Wolff mentioned, time is our enemy when it comes to research. The IRB process itself, even though we weren't actually seeing patients face-to-face, we were just distributing a survey, the IRB process still took about 9 months to complete. They're pretty strict, and that's good because it's for safety and precautionary reasons. But that was the bulk of our issue. And then twofold, it was once we have our data, it takes a very long time to filter through and organize what you have. So that was kind of the overall gist. We used Facebook to distribute this Qualtrics online survey. And we got really great data and responses from that. And I can talk about it more, but that's just kind of a background to get started.
Thank you very much. I mean, that and the other thing that I'll add is my opinion was that the survey they put together by themselves relatively quickly was brilliant. I've seen surveys that were not particularly well conducted, and what they did was truly outstanding. So Jana, I see you as well. You want to tell me a little bit, or tell us a little bit more about what you did?
Sure. So hi, everyone. I'm Jana. I'm a 4th year from the Joplin campus. So I guess how it all started was 2 of my friends and I, Tara and Claire, who are also 4th years here in Joplin, and we approached Dr. Staudinger about halfway through our 2nd year of medical school, because we kind of, you know, after like living there for about 1.5 years and then doing a poverty simulation for bioethics, we kind of wanted to look at the methamphetamine using population here in Joplin, just because we were kind of brought into attention to the sort of meth problem here, and then also the socioeconomic barriers that this particular population in Joplin in general faces at large. And so, you know, we had this idea of trying to characterize some of the medical and dental health outcomes within this population, comparing it to those who have recovered from methamphetamine and also to those who have never been affected by methamphetamine addiction. And then initially we had really wanted to look at oral IL-6 levels to sort of measure levels of inflammation within these 3 cohorts and see if, you know, there is indeed a higher level of inflammation in methamphetamine users as compared to non-users, and if that higher level would return back to quote unquote baseline after a set amount of time of being in recovery. So I guess similar to what Molly experienced, the IRB process was definitely difficult. And we had the guidance of Dr. Staudinger and Dr. Wells-Lewis, who is a professor at MSSU. We did our IRB through the MSSU IRB board instead of doing it through KCU, because it was under the MSSU Kcu Research Consortium. So we were kind of, we're really grateful that Dr. Staudinger took us under his wing as, the research consortium was kind of in its infancy and then building up to what it has become today. That in itself was tough. And then we also kind of, what was I saying? Oh, applied for a grant through the school, sort of under the wing of some of Dr. Stauninger's other projects as well. And that kind of allowed us to give a sort of compensation / gift card for participants within the Joplin community who wanted to participate in our study. And so how we did our surveys was we went out into the community into several locations. We started out in Access Family Healthcare, and then we also did St. Peter's Outreach House. And then later on, the recovery, like community center, The Rock, where we found a lot of our recovered participants. And, as researchers, it took a lot of time just coming up with a survey. And even as we were giving the survey and as we were collecting participants, we realized that there were so many improvements that we could have made, ways that we could have restated questions and restructured the survey in itself that would have lended to easier statistical analysis, better data output in general. But it's a learning process. And I think that in itself was very useful for us as medical students and future clinician researchers. And then because of COVID, we had to take a year-long hiatus. So then our RB expired, we had to get that renewed. And then we also had to make IVC amendments because, we were collecting saliva samples, and that is potentially could be, an infection / biohazard, biohazard, like, what's the word I'm looking for? Concern. So after all of that, thankfully, we were able to collect, the number of participants, and ours was nowhere near what you guys did, Molly. We wanted 60 participants, which was a completely a number we just were like, okay, this sounds pretty reasonable to collect. We didn't know how many people would be willing to participate in our study too. So, we really wanted to kind of stay more conservative. And, thankfully we found that so many of the people here in Joplin were really honest, really willing to participate in our study, and, surprisingly really appreciative of the fact that people were even interested in them, in that population as a whole, because they feel like overall, they're judged by healthcare specifically, well, I don't want people to think that any and all health problems that I have are because of my meth use, and so that was really touching and moving to see that we could potentially give them a platform and make them feel reassured that that isn't always the case. So that's a little bit about our experience. Thankfully, I did have a little bit of experience using SPSS, which is like a statistical analysis software. And so that was my area of expertise per se in terms of the data analysis. And yeah, that's just a little bit about what we experienced through our little study.
All right, thank you much. Can we just go around the table here quickly? So, Mira, you want to?
My name is Mira. I'm one of the emergency medicine residents, interns, at Freeman, Joplin. I did some research prior to medical school. I did case studies, case series, retrospective studies, and prospective studies. And that was the only time I really discussed my research, was applying to medical school, but I didn't really talk much about it when I was applying for residency spots. Right. Most residency programs will have you do a research project. It's an ACGME requirement for emergency medicine. So while you're in residency, you'll work on a research project. And in my class, we decided to work on it together. Sometimes they'll even make a distinction between quality improvement projects, QI projects, and just research projects. And so you might look into ways to improve your hospital, like looking into why you have high risk of infection for certain central lines, or in our case, we're looking at some COVID data and seeing if that's how that vaccination rates are for all hospitalized COVID patients, how they are affecting morbidity and mortalities, and we're working on that as a group. And of course, we're all still in the beginning of that project, but you start out with a literature review, and then right now we're all working through the IRB process, which we all know takes time. We are looking into KCU students helping out because there is going to be a lot of data to sort through, but we're still, like I said, in the beginning process of that project. So we are getting the IRB approval, and it sounds like if we need any help from KCU students, they would also have to get the IRB training and be included in that application.
Hi, everyone. My name is Sneaky. I'm an anatomy fellow on the Joplin campus. And so this year, as a part of requirement for the anatomy fellowship, we conduct cadaveric research. And since I'm interested in emergency medicine, I wanted to focus my cadaveric research particularly based on a procedure that's commonly done in emergency medicine. And so I chose chest tube insertions. And as they teach a lot of students, medical students and physicians, you will make sure to avoid that intercostal neurovascular bundle by staying as close to the inferior rib, forming that intercostal space. And so that was my goal. My goal with my research was to measure the structures running within that costal groove, the intercostal neurovascular bundle. And so some of the pitfalls that I found with cadaveric research that I didn't realize was these studies didn't have a great amount of samples. And something that a pitfall I faced here at KCU is my dissection is, delayed because we need to make sure the students get the most out of their dissection experience. And so you have a very short window to dissect. And so I think I was able to dissect maybe late November to early January. And in between that, breaks fell, and the dissection was very time consuming. And oftentimes what you see in a textbook, what looks very clear to you in a textbook is not the case on a cadaver. And so those are things I kind of realized as I went through my research throughout the year. Also getting students on my research, a lot of first year and second year medical students were very interested. However, my schedule didn't align with theirs always. And my dissections also took place neuro for first years. And so that's a very intensive class. So I wasn't able to utilize them as much as I wanted to. So hopefully, they'll be able to get on cadaveric research in their second year, but those are common things that I just noticed throughout the year I wish I had known going into my research.
Hi, my name is Colin. I'm one of the OMM fellows in Joplin. My first experience with research with KCU has not been very productive. Originally, I was going to do, I'm sure Michael and Darcy will talk about their experience with Dr. Vassar, but because I'm Canadian, my plan was to do that over the summer between first and second, or second and third year. But we were told that because we're Canadian, we're not allowed to do that. So that was shut down. This year with my required research for the OMM fellowship, I was planning on doing a study on suboccipital inhibition and comparing that to a sham therapy. I had some of my IRB stuff filled out. We were going to measure the vertebral artery blood flow with Doppler ultrasound, which Dr. Nichols had a grant for the butterfly ultrasounds. I met with Shelley Sloan, and I think maybe I got some questionable advice as far as what really needed to be done, having like extra groups, lay people as the treatment sham group, nothing I'd really seen before in like basic physiology research. So I was kind of thrown off by that, kind of got back on track, but have sort of delayed my application. Basically, I don't think I'm going to get anything approved on time. So I'm kind of thrown off just hearing all the feedback from the IRB applications.
what I was going to suggest is that the important thing is just to reach out to people, you know, and I serve on the IRB committee at MSSU actually, but I'm on the research committee here. And we don't have a budget, but I am aware of IRB, you know, length of time required and stuff here. So we do bring things like that up for discussion. And when you have other problems, I mean, along the lines of things that I think are so important that people don't necessarily do beforehand is design the research project around what statistics you want to use and know what questions you want to ask at the end, and know how your surveys or anything that you're going to do is going to feed directly into that. And, you know, even do a trial run with some other people and see how other people would fill out your survey, things like that, just to get some idea of where things can fail. Because I swear that I've done many things where it couldn't possibly go wrong, and it did. And you guys now are in that period where your time is so extremely valuable. And so any pitfalls that you can avoid early on are just so vitally important. So go ahead, Jeff.
I was just going to dovetail on that comment. I'm sorry, Colin, about your experience. I'm not surprised to hear the IRB snafus. And Molly, 9 months, my goodness, that's unacceptable in my view. That's one of the first things I did when I came to KCU was put in place something called a reliance agreement with 2 IRBs in Joplin. One is the Freeman IRB and the other is the MSSU IRB. And as Dr. Wolff told you, we have a plant on the MSSU IRB, him. So, but that requires you to form a collaboration with either a Freeman clinician or an MSSU faculty member in order to utilize their IRB. And that's why Jana and I talked about this very early on and said we need to bring Dr. Wells Lewis, a professor at MSSU, on board so we can use their IRB, because that is a major barrier that I'm aware of at KCU. And so my apologies, profound apologies for that. And it's a topic of discussion, so thank you. I'll stop there.
See, Molly's hand is up. Go ahead.
I just wanted to say, don't give up hope. I felt like the most challenging part for the IRB for me and my group was we didn't really know what the questions on the IRB wanted as, you know, a response. So it was very helpful to kind of have just like an example of someone else's to kind of follow along with, because our biggest struggle was we got this huge document and we're like, oh, what does this mean? Does that apply to us or not? And then, you know, the back and forth, once you submit it, the changes you need to make, sometimes that can take a little while between edits. But the bulk of our struggle was just not knowing quite how to answer the questions. So it really helps if you
Along those lines,
reach out to someone you know.
Jump in.
And
I was just going to jump in that's actually been something that I've been saying, is that for every student, you're approaching it the first time, you're novices, and you submit it to a table where well-paid people sit around and look at it and go, well, that's crap. And you send it back and you don't necessarily get the type of feedback. And so what I've said, so there's 2 things. I'm told that there's kind of a point and click IRB process with some software. So I've suggested to administration here that they might look in that, where it almost, you know, you click what you need and it can potentially write much of what you need and document it. The other thing that I've said would be really helpful is if we had a liaison where you reached out to that liaison and talked to that person who said, well, you know, what is it that you want to do? This is the type of language that you have to put in there. This is how you protect for confidentiality. This is what anonymity means. These are the things that are red flags for committee members. So my hope is that somehow we can get that streamlined more, but I'm aware, I mean, you know, with IACUC, I'm an animal person. The IACUC also can sometimes just drag on forever in various committees because You don't have an idea necessarily of what they want or what their hot spots are. And, you know, some people have conniptions over a dotted I missing or the T that wasn't fully crossed. So there are all sorts of things that can be impediments, and certainly a goal, I think, of the research committee going forward is going to try to be to figure out how we can iron some of those out. So go ahead, Michael.
So I'm Michael Weaver. I'm a PGY1 internal medicine over at Freeman, and I'm not going to harp on the IRB too much other than to say the one at Freeman has taken me like 1 or 2 months every time I've gone through it. So if you're interested in doing something IRB based, come find me. We can set you up with a Freeman doc pretty easily. So my research experience, I started way back in undergrad when I was at Missouri Southern. I did a project through the IRB doing a survey. So props to you guys who did surveys. That is not a fun process. People don't like responding, and that's always great when you don't have data. But through the years, I've done a lot of different kinds of research projects. Starting out in medical school, I did a lot of case reports, and I would highly recommend to any of you guys who are listening to this that case reports are the place to start. It really gets you a good handle on doing a literature review and really learning how to summarize your writing, because every single case report journal requires you to have a really short, concise script. You're not allowed to use a lot of words, and that's pretty common throughout research. I know, like undergrad, we got used to, you have to write this many pages. Completely opposite in the research world. So get used to writing those projects, and it's a really quick way to do it. And just about any residency that you go to, if you have an interesting patient and you want to do a case write-up of it, residents are hungry for research projects because ACGME requires us to do at least one. I would be willing to sign off on anyone's case reports. In fact, I'm working on one with a student right now and just revising it and helping them to learn what's the process for writing appropriately. So highly encourage that. Additionally, I worked with the Vassar research team down in Tulsa, Oklahoma at the Oklahoma State University Center for Health Sciences, their medical school. Really great experience. A lot of the work down there was meta research, so looking over quality of research and really learning how to dig into it. I would say more than just getting publications there, which there are several, and if you join them, you will also get several. Props to Dr. Vassar's team. But it's really taught me how to dig into research and really critically evaluate it. Even in our journal clubs as an internal medicine residency, a lot of the time other residents will look to me when they have questions about interpreting research, which is very strange as a PGY1 to have that happen in your first couple months. But if you guys are familiar with research from the aspect of having done it, I think that's more important than a lot of the projects that you end up passing, because as we all say, we look back on a previous project and we think, I could have done that so much better. But as a result of doing that, you're better able to critique other people's projects and better able to critique research, which is incredibly important, especially with how rapidly everything changes in medicine now. So my advice, get a hold of some residents wherever you're doing rotations. Even now as first and second years, you can reach out to us at Freeman. I'm sure we have stuff that you can jump on and help with, and I'd be happy to even read over manuscripts or anything like that. Just send them my way.
I was just going to comment on one other thing that I forgot to mention earlier, and that was as I looked through the work that KCU students did in the recent past, a lot of people from this school and others have done these stat pearls. Have you seen those things in PubMed or whatever, like 2-page, you know, little synopsis of some, yeah, it's a book report, but it ends up being something people can put on their CV.
It's a published, people cite stat pearls all the time.
Yeah.
People cite stat pearls all the time, quite a bit. I don't know if it's a good practice to do it, but I've seen it cited before.
It's PubMed indexed, it counts.
Yeah.
You can put that on.
Well, just because it's PubMed indexed, you know. Well, I guess that's a good segue for me. I like what Dr. Weaver over here had to say. My name is Robert Steele. I'm a 4th-year medical student. I was also an anatomy fellow. Came to medical school with zero research. I was a biochemistry undergraduate, so I did bench research and know my molecular biology and stuff like that. But that doesn't help me as a clinician or a physician. So I decided to do the anatomy fellowship, and that kicked off my interest in cadaveric morphometry, which is the study of cadaveric, basically structural anatomy, and doing that properly. And there's a whole field of study of morphometry. So I've done quite a bit of cadaveric work, a large 208 sample, collected over like 14,000 data points. I'm working on the second paper publication for that, which has taken a while. I'm using Python, which is a programming language, to basically chunk up my data and present it in a way that I think will be very clinically significant, especially since I captured 14 points along a nerve pathway. So I'm excited for that. Now you might be wondering, oh my gosh, how did I get from point A of no research to this? Thousands and thousands of hours of reading and work. That's it. I had to learn. It's not easy. You have to put in the work. Most students that I find approach me research, I'm gonna be the hardballer here, sorry. I used to be an infantryman. I don't, feelings are important, but this is kind of tough love that a lot of students need to hear, because most students, when they approach you for research, they have this grandiose idea that they're just gonna jump in on a publication or are already there and they want their name in and they think they deserve authorship on your research that you've put hundreds of hours into. And there's kind of an air of entitlement for a lot of students that approach you with research, and it makes it frustrating for somebody who's had to learn research on their own and spent the time and the blood and the sweat and the tears collecting the data, standing in a freezing crematorium in South Kansas City in the middle of a really tough area at 2 a.m. to collect my research. I mean, it's that type of stuff. It's Molly and Jana explaining their process. So what's the point of this? You got to start somewhere. You got to start with case reports. You got to start with reading. You have to do literature reviews. You got to start reading the stuff you're interested in. People always say, I don't know what to ask. I don't have any ideas. How do you have all these ideas all the time? Well, I have a phone and I have a notepad. Whenever I'm reading something, I go, well, how does that work? And I write it down. And then I go investigate it when I go home. That's just one way to spur ideas. I read all the time. I read cadaveric literature. I stay up in Annals of Anatomy because that's kind of my area that I like. I stay up in the field that I'm interested in. I'm also doing meta-analyses because I want to expand my statistical background. I just did one for Tulsa. So you don't have to stay in one lane, but you got to start somewhere. And it starts with putting in the legwork. So I'm more than willing to help people publish. There's lots of ways to get published. There's lots and lots of little tricks you can do to easily get published. Not everything has to be this arduous, like I got to publish a paper. Unfortunately, that's kind of the mentality. It's the quality over quantity argument. I agree. However, if you're producing quantity of good case reports, good case series, I mean, that's not bad. Case series stir pilot studies. Pilot studies stir actual research. You never know what you're going to kind of uncover. So stay curious, stay reading. And if you have any questions, feel free to reach out to me.
My name's Darcy. I am a fellow here. So how I got involved in research was in my master's degree in chemical engineering. I worked on a project for 2 years, and that didn't actually get published until my second year of medical school. So coming to medical school, I really didn't want to do bench work or anything that required an IRB due to the fact that it would take so much time. My advice would be network. Prior to coming here, I was on Student Doctor Network, and I met Dr. Vassar on there from Oklahoma State. And that summer, I worked from home and got 2 publications before even starting medical school. When I got to medical school, I worked 1 more summer with Dr. Vassar and was able to get 4 more research projects, which was great. My biggest takeaway from that was learning how to write. I think a lot of medical students know science, but they don't actually know how to write a manuscript. Because of that, this year during my fellowship, I've been put on 2 case presentations, as well as in my 3rd year of medical school. I don't know why I'm here. In my 3rd year of medical school, I was asked to help write a Kcu paper because the people in the residency and the program directors were struggling to write the paper itself. So that writing skills that I gained at Oklahoma State, as well as from my master's degree, really paid off. Additionally, being a fellow here, I've been put on multiple projects because of writing specifically. So I would say, not only do I agree with everything Michael's saying, but also network and learn to write, because it's a really important skill that you can have.
So my name is Katie Harden, and I am not a student or a physician. I'm actually one of the residency placement coordinators with KCU. You want me to come over here? Hey, camera's up there. Okay, so one of the common questions we're asked as advisors for the residency process by students is, do I need research? I think that's a question that has kind of a very complex answer as you're looking at applying to residency programs. My advice to you, for those of you asking that kind of question, is I don't have any research. Do I need some research to be competitive? Is look at the specialty and the programs that you're looking at applying to. So we're finding that there are some of the very competitive specialties, some of your more surgical specialties, your academic health center programs, they tend to rely very heavily on research. They want to see that in your CV. They want to see that you've got that, especially your hospitals, your health systems that have huge research programs tied to their residency programs. Like the physicians have already touched on, research is a requirement for ACGME accreditation. So you're going to have scholarly activity as a resident, no matter what. But those programs that have very large research programs tied to their residency programs, they expect you to have a lot of research background in order to even look at your application. So as you're looking at programs and considering where you want to be applying to residency, that's the kind of stuff you need to be paying attention to. Am I applying to a specialty where that's important? Am I applying to programs where that's a big deal? The other thing that we found this year is there are actually a couple of specialties that we're finding research being completed in the specialty you're applying to is actually a big deal for some of these programs. We actually had a student that was told because they didn't have the research in their specialty, the program didn't rank them high. They liked them, but they wanted them to actually have it in their specialty. So just some advice to take home with you as you're looking at deciding whether or not to get involved as a first, second, or third year is really do your research on whether or not the programs and the specialties you're applying to, if that's a big deal to make you a competitive applicant for these programs.
I want to add something on that. That kind of for me is what spurred, my curiosity with doing and getting so many publications and actively publishing and collecting this repertoire of like journal publications that is just a neat little thing on your CV. Like why was I doing it? I wanted orthopedic surgery. I knew I had to get a ton of research, but I found a passion for research in it, which is really cool, which is what fueled now what I'm going to be doing in the future. But in doing so, what Katie was saying, she goes, okay, well, you gotta know what you want to do, unfortunately, early on now in medical school. And you have to be real with yourself about getting there. It's hard to get a lot of these publications. But if you want it, you can do it. You can do it at KCU. I think we're all case examples of it. So it's possible. You just got to do the work. Well, I soaped. So I applied orthopedic surgery. I applied very narrow because I have a family and we live here in Joplin, and I applied very local, which there's not a lot of local orthopedic surgery residencies. So I kind of artificially limited myself. But on the orthopedic audition rotation trail, my research was talked about. It was a frequent talking point about what I've done. They go, okay, well, why'd you do this? They were interested. They actually commented on, what I could do for them. I got conversations about doing research with interns at the place I wanted to go, and I did a meta-analysis for them. I had never done a meta-analysis before. Okay, but what did I do? I read Cochrane's reviews. I read that whole book. I read statistical effect size basically for dummies, but it's not. It's a statistical effect size book. I did the work. So it's like that can spur a lot of stuff. So yeah, that's the match process. It's talked about in the surgical subspecialties.
Yeah, I see Molly and Jana with the hands up. So Molly, you're on my left. So go ahead, please.
Sure. So one thing I wanted to mention, because a lot of this can be overwhelming, is in my case, obviously it depends what you're looking into, but our group of girls, when we created this survey, we created a pretty broad survey that covered a few different areas like birthing practices, demographics, as well as a PHQ-9. And so even though we did this huge IRB and this huge survey, we could actually take it a few different angles and get, 3 or 4 posters out of that same project. So, if you're like, wow, how am I going to do all 5 IRBs I want to do? Well, depending on what you're looking at, you can consolidate some of that, do it once, and then use the data to kind of help different projects. So that's another area that I think can help people who are a little overwhelmed, but still want to kind of buffer their resume in terms of numbers.
Thanks, Janet.
I think I just wanted to build on a little bit about what Rob said. Like, yes, research and, getting yourself published is definitely hard work. But I think something that Dr. Staudinger and I were talking about yesterday is, trying to find something that actually sparks your interest and your passion, because you're going to be able to maintain that fire, if it takes you like 2 or 3 years or however long it takes you to get through this entire research process. You're going to be able to sustain that energy you're much more likely to sustain that energy than if you were to just hop on a project because you wanted to put it on your CV. I applied internal medicine, and it's not a field that's particularly competitive unless you're going to like really big academic centers. And I applied to both academic and smaller community hospitals that were affiliated with universities. And even though it's not a specialty that requires research per se, it was definitely something that a lot of program directors and attendings brought up when I was on the interview trail, because they want to see that sort of interest and that sort of drive in their future residents, because that is something that you could be potentially contributing towards during your residency program. So just little things to think about.
As far as the matching process, most of my research prior to medical school was in the OBGYN field, and I applied emergency medicine. So it was very different fields, but I think I could still use my experience to say I've written abstracts before, I've written publications, and just being familiar with the process reassures the program that you've been through it once and you can do it again. It's a lot easier to guide someone who knows what to expect for that kind of project. And then as far as making your resume look good, there's other things you can do besides research. And Dr. Wolff mentioned showing interest in the specialty that you are interested in. So small things like joining the emergency medicine club, as soon as it was founded in Joplin, I did that. Being part of the board of a student club. One thing you can also share projects with some classmates. One thing we did as a class, people who are interested in getting a small publication, we looked into local resources in Joplin for people with substance abuse or children with disabilities, and just put all the local addresses and contact information, published that, and that was something that I could also list under publications. But you can also do meta-analyses or look into, why is there a shortage of cadavers in the US? Or you can pick a topic and that doesn't necessarily involve patients, and write a paper about that can be easily published. You don't necessarily need to go through the full IRB process just to show interest in the specialty that you are interested in. But also that does depend on what specialty you apply for. Emergency medicine does care about research, but not as much as, some of the surgical specialties or ortho, for example.
I'm a talker, sorry. There's free data out there. And if you have a question, I guarantee, and that's not a good way to look, that's not a good way, but you cannot do that and create a research project. But what you can do is create a question to then create a research project, and then go after the data. So there's large databases out there. There's with the professors, if you have a PhD and are a university affiliated, I think there's a lot of Medicare, Medicaid databases available. There's also, there used to be a poster up in the office. that has like it was like maybe Dr. Z took that down. It was like a database of ICD codes and prevalences in the United States is constantly updated. Like there's stuff out there. There's a rich world of resources on the Googler. So get your questions out on the Google machine and start figuring out how to look at some of it. That's what I'm referencing to. I don't remember what it was called though.
It's an online database.
Mhm.
It's the sort that the anatomy fellows have.
It's very powerful too. People publish from it quite a bit. And KCU students have done posters off of it. Like that's stuff first and second years could do easily.
Yeah. For meta-analysis, Scopus is really important. That's one of the big ones I know that we used at Oklahoma State to get multiple publications. And the good thing about meta-analysis, as these others have said, is you can do projects directly in your field of medicine that you plan to go into. So like every project that I had was either diabetes, obesity, or cancer because I plan to go into primary care.
And there's literally a meta-analysis question for anything. I promise you. Like, but you got to be careful with you have to be careful with meta-analyses.
There's also people that are trying to figure out, what are the best strategies. So like Gretchen Collar, whatever last name is has career dreams in neurosurgery. And so they were looking at, where should you apply based on where you were at and things like that? What impact did that have? So there's a lot of unknowns out there and just getting a handle, that's among the reasons Katie is here, because they sat and, they looked at what was important. So with this change now, there's a lot of questions as to what's important. What is the best advice to give people going forward? But keeping your eyes open, I think the advice that's been given here is extraordinarily valuable.
I'll say one thing, Dr. Staudinger, then I'll throw it to you. As far as meta-analysis, there's a meta-analysis question for everything. And there's also plenty of meta-analyses that are out there that are very poorly done. Come ask me, I have all the research to support that they're badly done. If you want to redo them, it would be easy to do. Back to you, Dr. Staudinger.
Thank you for that comment. There's a lot of BS in the literature, there's no question. I wanted to dovetail on a couple of things that student Dr. Hicano and the student doctor to your right, Dr. Wolff. I'm sorry, I don't see any names in the room. But what I wanted to do was, I wanted to emphasize a couple of points and re-emphasize for everybody. Do something that sparks your passion, and hopefully it aligns with your desired outcome as a clinician. And moreover, the struggle per se is part of the process. I agree totally that residency directors want you to be familiar with the process, but they also want to know that you struggled through the process and were able to overcome. So if you can sit in that potential residency director's office and speak with passion about what you achieved, and speak with acumen about the process and the struggles you went through to achieve what you achieved on your CV or through your research project, I think goes miles towards raising your prospects for landing the residency of your dreams. So passion, and don't be afraid to articulate the fact that you struggled but achieved.
I had good mentors. I had good PIs. I had Dr. Wolff, Dr. Staudinger, I had Dr. Brower, I had Dr. Dennis. Like I had people supporting me too. So associate with good professors.
It looks like nobody sitting around the table here has anything else to add, but well, thank you much for coming. Hopefully somebody will make use of this someday. Otherwise, we're just preaching to the choir, I guess. But thank you much, Molly, for checking in from Kansas City, and it's nice seeing people. Ken, thanks for coming.
Thank you, Katie.
And hopefully things are going to go well.